Serious fractures are frequently treated with surgery. Minor fractures can also be treated with splints, braces, and casts to support the foot in addition to surgery. Minor fractures do not necessarily necessitate surgery, but they can be immobilized with a cast. Depending on the location and severity of the fracture, surgery is not always required. There is a common misconception that treating fractures at an orthopedic doctor requires surgery. It's no surprise that many people turn to alternative medicine when they are confronted with this situation. The assumption is in fact quite right. Surgery is a viable option for major fractures or those that occur in critical areas of the body. If the fracture is classed as light, doctors may recommend that it be appropriately managed by wearing a brace or leg support. How can you know how serious a fracture is? Only with the assistance of a doctor can the severity of the fracture be evaluated. To begin, the doctor will do a scan test, such as an X-ray, CT scan, or MRI, to assess the status of your fracture. The severity of your fracture will also be determined based on the results of this scan. After that, the doctor will treat the issue appropriately. A broken leg, for example, will be treated differently than a broken hand. Fractures can be treated without surgery. The bone will in essence, mend and reattach on its own. The purpose of treatment is to make sure that the fractures are properly mended and that they may be used again. If the fracture is minor and does not require surgery, the doctor may suggest one of the following fracture treatment options. Use a splint to keep the fracture from moving. Use a brace to help support and stabilize shattered bones. A cast that holds a shattered bone in place and prevents it from moving. To ease discomfort in the region of your fracture, your doctor may prescribe pain medications such as ibuprofen. If you have a history of pharmaceutical allergies, talk to your doctor about getting alternate prescriptions. When is it appropriate to operate on a shattered bone? When the fracture is serious and not expected to heal with the foregoing treatments alone, the doctor will propose surgery. This form of fracture therapy is typically used when fractures commonly occur around joints, such as the wrists and ankles. The patient's capacity to move or mobility will be affected if the bones around the joint cannot be healed. Broken bones protrude through the skin. Procedure for fracture surgery. You don't have to be concerned about having fracture surgery because it normally takes only a few hours. Depending on the location and severity of the fracture, the patient may be placed under general or local anesthetic throughout the procedure. A unique metal will be used to reconnect broken bones. If the fracture conditions do not allow for direct connection, doctors may be able to use other bone pieces in your body. During this surgical process, the blood vessels surrounding the damaged bone will be healed as well. Following the operation, the fractured section of the body must be supported. Depending on whether your condition is stable or not, you will be discharged within a few hours to a few days after the operation. The procedure for recovering after a fracture. Following treatment for your fracture, you should expect to be out of commission for 6 to 8 weeks. The length of time it takes to recover is determined by the severity and location of the fracture. You may be able to hasten the healing of a fracture in the following ways. Taking supplements, such as protein and mineral supplements. Antioxidants such as lycopene, vitamin C, vitamin E, and alpha-lipoic acid should be consumed. Stretch lightly, but always consult your doctor or a licensed therapist before doing so. You must not smoke. If you suspect you have a fracture, don't wait for it to get worse before seeking medical help. This allows for the right treatment of fractures. Inappropriate treatment has the potential to cause problems in the form of impairment or a permanent reduction of mobility. Thank you for watching and please subscribe for our next video.